We're coming to you from the Tygerberg Hospital in the Cape Town Metro that has acted as the nerve centre for the COVID-19 pandemic response from the Western Cape government. Now today we had a briefing exactly 1 year after the first case in the Western Cape was announced on the 11th of April. Now since then, 11,319 people have succumbed to COVID-19. Of those, 122 are healthcare workers. Now, in a year's time, we've also seen a vaccine come, and thus far, just over 21,000 healthcare workers have been vaccinated with the Johnson & Johnson trial vaccines. Now, we heard today from the provincial government sort of doing an overview and taking us back to those key moments that changed the lives of everyone in the country, but in the Western Cape as well, talking to us about the second wave that was extremely devastating. That started in October, and we're only now seeing an exit out of that second wave, with numbers declining rapidly for the past several weeks. And today we heard that the infection rate is extremely low at the moment, but also we heard from provincial government that now is the time to be extra cautious and vigilant, because a third wave is almost a foregone conclusion. We've heard now from the HOD of the Western Cape Department, Dr. Keith Klute, telling us, depending on how people behave during the Easter holidays, with distanciating themselves and with traveling, the third wave could start shortly after that. So now is a crucial time for people to keep up the vigilance. Constant vigilance is the word. People must remain social distancing, they must wear their masks, they must sanitize, adhere to those COVID-19 protocols, because Dr. Klute telling us the province is preparing for the third wave as if it will be as devastating as the second one was. Now, of course, the buzzwords at the moment is vaccination for everyone, but at this stage, given the number of vaccines that have been procured for South Africa and waiting on deliveries, Dr. Klute says it is unlikely that the vaccination program might have a mitigating impact on the third wave. So people's best bet at this stage is still what I'm wearing on my face now, a mask, social distancing, telling people to stay cautious. But they also took some time to talk about the plight of healthcare workers, the absolute traumatic time that they have been through with the two waves and still going through, saying that from next week they are going around to over 40 facilities within the province, giving healthcare workers an opportunity to sit down and discuss what they've been through. As in all major happenings around the world, one does not always have time to think about loss and trauma while you're in it, and now is the time to take care of healthcare workers. We also heard from the professionals saying if there was anything they could have done differently, they would have focused more on the human impact, especially on the side of patients that lay dying in bed and they have no contact with their families. Their families aren't afforded a chance to say goodbye or stand by their bedside, but it has been healthcare workers that were standing next to their beds, trying to give some comfort in those last moments. And of course, reminding us again that it is in our own hands what will happen with the third wave. The Western Cape telling us they are ready for a massive scale rollout of vaccination. They are just awaiting from national government to hear when and how much of vaccines will be coming to the country. We know that Johnson & Johnson will be supplying a large number of vaccines, and the Pfizer-BioNTech vaccine is also expected to arrive in the country towards the end of March, in April. And the province saying they're ready, but until the vaccines are here, it's a waiting game and asking people to remain constantly vigilant.